Hi, my name is Jen Lowe. I am a licensed professional counselor and a registered play therapist in Jackson, Michigan. I treat children, teenagers, and ladies with anxiety and trauma. This particular video is going to talk about an option called EMDR. EMDR stands for eye movement, desensitization, and reprocessing. Eye movement desensitization and reprocessing is specifically a treatment for trauma, PTSD, people who have experienced upsetting life events. Eye movement desensitization and reprocessing would be a wonderful option for people who have tried traditional talk therapy for their PTSD or post-traumatic stress disorder for a number of years and have not seen a reduction in their symptoms. Unfortunately, a lot of people get diagnosed with PTSD, go to counseling services with people who are not trauma informed or not trained in EMDR. They talk about their trauma and they do not see a reduction in flashbacks, nightmares, avoidance, re-experiencing, and so they start to feel hopeless that I have PTSD and it's really bad and nothing helps me. So EMDR would be a really great option. I offer a free 10-minute phone consultation, but even that first session would be something we call resourcing skills, which are similar to coping skills. So you could try EMDR without the trauma processing aspect. It would be doing something like a calm place, for instance, and you could try those eye movements in a very slow, safe way, just thinking about your favorite place or a calm, relaxing, peaceful place. And it would be a way to try it and see what it's like before you start the trauma processing aspect. Eye movements can be done in quite a number of ways. So the lady that first invented it, she would have her client sit across from her a little bit over, and she would hold up her arm and she would move her hand back and forth, and the client would follow her hand with their eyes. Since that, more research has been done on this treatment and other ways of doing that have been developed. There was a Grey's Anatomy episode years ago where they actually did a pretty good job portraying what EMDR is like, but the doctor who went to this therapy, her doctor had a light bar. So a light bar can be on a stand or on the wall. And so when the therapist turns it on, there's a light that goes back and forth. So the client just watches that light go across the bar. I personally buy something from a company called Neurotech. It's called tappers, but my little kids call them buzzies because they vibrate. And so there's one for clients' left hands, there's one for clients' right hand. And when I turn it on, it vibrates back and forth. And the therapist can adjust the speed of this. They can adjust the intensity of these. So there's a way to sort of make it comfortable and make it best for each person. So they vibrate back and forth. And when I hold them and close my eyes, I can feel my pupils sort of moving back and forth. Or I can feel my little pupil on my left and my right, left, right, left, right. What this does is something we call bilateral stimulation. All it means is it's engaging both sides of the brain, our left hemisphere, our right hemisphere, our left hemisphere, our right hemisphere. Okay. Again, a great option for people who are experiencing symptoms of trauma or PTSD. It can be used with kids and teenagers. I'm a registered play therapist. So as we can do this in a fun way too, and I have some specific interventions specifically for kids and teenagers as well. I will link a video from EMDR in the description box below. There are 2 cute YouTube videos for kids that explain what EMDR is like. I offer a free 10-minute phone consultation. The first session of EMDR is just going over a little bit of family background information, some goals that you have for therapy, some specific targets or things you want to, and then you can try this with a resourcing skill. You can try that with thinking about your calm place. All therapists who are trained in EMDR, they might have different resourcing skills, but a calm place is one that we're pretty much all trained in. And that would be a really good opportunity. The eye movements would go very, very slowly for you to just sort of feel what that is like or what that feels like for you. And so, yeah, it is worth trying. My website is jenlow.care. I am in network with Blue Cross Blue Shield and Aetna. Best of luck in your search.